Kidney disease is a leading and rapidly growing cause of death globally, and the most worrying aspect is that 90% of people are completely unaware they have it. In this article, we'll examine 8 indicators of kidney failure and the need for immediate intervention. We'll then outline some effective strategies for maintaining your kidney health. The kidneys, located on either side of the lower lumbar region, are our body's natural purifiers. These vital organs eliminate excess uric acid and ensure an optimal balance of essential elements such as calcium, sodium, and phosphorus in the body. Thanks to their proper functioning, blood pressure is maintained within normal parameters. Furthermore, the kidneys are responsible for blood production and controlling hemoglobin levels. But before continuing, please like the video, share it with people who might benefit from it, and let us know in the comments which city you follow our YouTube channel from. Vitamin D, which we absorb from sunlight or through food, is completely useless without renal activation. Therefore, when a key organ like the kidneys exhibits functional abnormalities, all these vital functions are significantly impaired. The main difficulty lies in the fact that during the early stages of kidney deterioration, obvious symptoms rarely appear until kidney dysfunction is diagnosed. By the time the problem is identified, 80% of the kidney damage has already occurred. But don't be alarmed if you remain vigilant and proactive. You can easily identify kidney problems early through specific warning signs. First symptom: urinary changes or blood in the urine. The most reliable sign that can immediately indicate kidney failure is changes in urine. A normal person urinates 6 to 10 times a day, but if the frequency suddenly changes, increasing or decreasing, especially if you have to get up repeatedly during the night, this should be cause for concern. Some people may feel the urge to urinate but only produce small amounts. This insufficient urination is a sign that kidney stones have dislodged into the ureter. Blood in the urine, also called hematuria, can signal kidney infections, tumors, stones, or kidney failure. When the kidneys aren't working properly, blood can leak into the urine, causing it to appear brown, red, or purple. Women may underestimate this symptom, linking it to menstrual irregularities, but they shouldn't. Foamy urine is not a good sign. Discolored urine with bubbles or whitish foam may indicate high protein concentrations in the urine. The protein should remain in the blood, but because the pores of the kidney filters have dilated, it begins to leak out through the urine. This protein loss is an early indicator of kidney disease and should not be ignored. The foam is very similar to the foam that forms when scrambled eggs, as it is actually albumin, the same protein found in eggs. The kidneys produce urine, so when they aren't functioning properly, urinary changes are frequent and significant. Second symptom: excessive fatigue. The kidneys filter all the toxic substances present in our body, so when they don't function properly, numerous impurities can accumulate in the blood. This can cause feelings of tiredness, weakness, mental confusion, and difficulty concentrating. Furthermore, healthy kidneys produce erythropoietin, a hormone that promotes the formation of red blood cells in the body. Red blood cells carry oxygen throughout the body. When red blood cells decrease, less oxygen reaches the organs, and less oxygen means less energy is available. This is why feeling tired despite getting an adequate night's sleep is considered an early sign of kidney problems. Specialists say that if fatigue is caused by kidney problems, the person lacks energy even for small daily activities. Simple activities like bathing or walking 50 steps become difficult. The lower your red blood cell count, the more tired and frail you'll feel, and this is where anemia sets in. Fatigue can have multiple causes, so to be sure, it's advisable to have specific blood tests for an accurate diagnosis. Third symptom: body swelling. If you notice swelling in your ankles or under your eyes almost every morning, don't ignore it. Impaired kidney function will cause excessive fluid accumulation in the body. Furthermore, when the kidneys fail, a lot of sodium will accumulate. When sodium increases in the blood, it retains fluid, and in cases of kidney damage, this fluid collects in the form of swollen legs, ankles, feet, or hands due to gravity. However, swelling of the extremities can also signal chronic liver, heart, or venous disease. Low levels of a protein called albumin can contribute to edema. This symptom is also seen in liver disease, as the kidneys and liver work closely together. So, check if you consistently experience swelling in these areas, as it may indicate kidney problems. Fourth symptom, difficulty breathing. Shortness of breath is usually attributed to heart or lung disease, but shortness of breath can also be caused by kidney disease. Excess fluids and toxins in the body that the kidneys cannot filter can accumulate in the lungs, causing shortness of breath. Additionally, a low red blood cell count and anemia can deprive the body of oxygen. In some severe cases, lying down can feel like drowning. This is when you should seek immediate medical attention. Difficulty breathing related to kidney problems is a warning sign that requires urgent medical attention to avoid more serious complications. Fifth symptom, dry, itchy skin. One of the main functions of the kidneys is to purify the blood, but when they fail to do so properly, this symptom called uremic pruritus occurs. In addition to filtering toxins from the body and helping to create red blood cells, the kidneys also help maintain the right amount of bone minerals. Therefore, dry, itchy skin may signal kidney failure, which is no longer able to maintain the body's mineral balance. Furthermore, the accumulation of toxins in the bloodstream can cause various skin reactions. Some people may experience itching only on one part of the body, while for others it can spread to other areas. The skin color may change from yellowish to brownish, indicating underlying toxins. This is why, in 10% of cases, kidney problems are diagnosed by a dermatologist. So if you've had skin problems for a long time and have tried every remedy without relief, don't ignore it, as it's likely an underlying kidney problem. The skin often represents a reflection of internal health, and persistent skin changes always warrant further medical attention. Sixth symptom, bad breath and a metallic taste. People with kidney disease may complain of a metallic taste in food and may have persistent bad breath. Furthermore, people with this symptom may also experience a poor appetite. All of these effects are caused by a buildup of toxins called urea in the blood. Bad breath may be accompanied by nausea and vomiting. Even the thought of food can make you feel unwell. Don't wait too long at this stage. You should consult a doctor. The accumulation of toxic substances in the blood can cause these unpleasant symptoms, which significantly interfere with your quality of life. Seventh symptom, sleep disturbances. When the kidneys aren't functioning properly, they don't filter properly, so toxins remain in the bloodstream, creating all sorts of imbalances in the body. This makes it difficult to sleep and rest properly throughout the night. It can also cause sleep apnea, a sleep disorder that causes breathing to stop and start again while you're asleep. This can cause loud snoring and, in some cases, can even be obstructive. Sleep disturbances linked to kidney problems can create a vicious cycle where lack of rest further worsens overall health. Disturbed sleep negatively affects the entire body and can aggravate existing kidney symptoms. Eighth symptom, hypertension and diabetes. These aren't actual symptoms, but one thing is certain. If you suffer from hypertension or diabetes, you're at high risk of developing kidney disease. In 40% of cases of kidney failure, hypertension is the primary cause, and 1 in 3 diabetic patients suffers kidney damage. This happens because when sugar levels remain uncontrolled, the blood thickens and consequently damages the small blood vessels in the kidneys. Similarly, hypertension damages the small vessels in the kidneys. High blood pressure is not only a cause but also a consequence of kidney disease. This is because one of the kidney's functions is to maintain blood pressure. But when they don't function properly, hypertension can occur. So, if you want to keep your kidneys healthy, keeping your blood pressure and blood sugar levels under control will be of great help. These are the first symptoms, often dismissed as minor. It's only after 70 to 80% of kidney damage that more obvious symptoms appear, but kidney damage can be slowed if you take care of some key aspects. The first recommendation is to drink enough water. Doctors agree that one of the main causes of kidney stones and kidney infections is dehydration. So drink between 4 and 6 glasses of water a day to help your kidneys function properly. Drinking warm or lukewarm water is even more beneficial. In a study where patients with kidney problems drank a liter of warm water over 30 minutes, creatinine levels decreased by 20% and urea levels by 40%. Nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, can damage the kidneys if used excessively. Antibiotics are another class of drugs that can severely affect the kidneys. They are powerful medications capable of eliminating bacteria from the body, but not without leaving harmful traces. Antibiotics contain many toxins, and your kidneys will be overworked trying to cleanse these toxic effects. If your kidneys are perfectly healthy, antibiotics won't cause many problems. However, if you have kidney problems, be sure to discuss them with a doctor before taking penicillin, sulfonamides, or other similar antibiotics. Medical consultation is essential to avoid further kidney damage caused by inappropriate medications. Regular exercise is essential for a healthy life. It's good for your physical fitness, heart, brain, lungs, and even your kidneys. Regular physical activity helps maintain optimal blood pressure for healthy kidneys. Run, bike, swim, or go for a walk every day, and you'll reap the long-term benefits. If you're over 60, born with a low birth weight, or have a family history of cardiovascular disease, you should have your kidney function checked regularly. This is the best way to prevent further complications. The kidneys are a powerful natural detoxification system that we often take for granted. But keep in mind that once the kidneys stop functioning, it's difficult to recover. So recognize these signs and work on your lifestyle to keep your kidneys healthy. If you found this content helpful, don't forget to like and subscribe to the channel. You can also encourage others to take care of their kidneys by sharing the video. See you in the next content.